As we wait for some additional folks to join, just thank you so much for joining us for the first part of our three-part webinar series with WellSpark Health on well-being programs that move employees from the inside out. My name is Annie C. I am one of our VPs of National Business Development here at WellSpark, but I'm also a certified health coach and a marketplace champion for diversity, equity, and inclusion at our enterprise, which is very important for our mission. I will be facilitating today's discussion with a great group of individuals who share a passion for helping the modern workforce achieve and sustain whole person health. So before we get started, just a couple housekeeping items. Just please note that this webinar is being recorded and we will be sharing it with all the registered attendees after this session. We've also reserved some time at the end for some Q&A, but please feel free to send questions to our team throughout the presentation and we'll try to get to as many as we can. For those of you who are jumping from WebEx to Zoom to Teams and back again, there are a couple of thought bubbles in the kind of top right-hand corner with a question mark, and that's where you can enter your questions. So I think let's just move on to some fun stuff. We'd love to kick it off with a short video just to give you a flavor with our life dimensional approach, and then we'll get started.
Hidden beneath the demographics that attempt to define us is a complex web of personal circumstances that more clearly determines who we are. It shapes our outlook on life, our motivations, and especially our health. And it's why WellSpark doesn't just rely on physical vital signs when it comes to wellness. We prefer a life dimensional approach that considers every reality of a person's life. Only then can we start the journey to a more enduring well.
So on the video, and as we get started here, some of you are meeting WellSpark for the first time. Some of you know us very well already. So today, as we kind of pop the presentation back on the screen here, we're going to be talking about our biopsychosocial model of health and well-being, which will really root us for our follow-up discussions and why cultural competency is key to connecting with employees and how we as vendors and consultants and coalition partners really have a responsibility for our client partners to help their modern workforce and their families feel supported and valued, not just supporting their physical health, but truly taking note of their emotional and their social vital signs as well. So just to shortly give you a view of our agenda today, we're going to be looking to build a truly holistic ecosystem to help prevent employees from falling through the cracks. That's going to be our main focus, as well as really talking about our vision to accomplish this through leveraging a biopsychosocial approach. And we all recognize the importance of removing barriers to care and to access. And so we all understand virtual modalities like Teams, very important, but mixing the human connection with those modalities is really what we find will help to spark hard to reach employees. And I think the best part of today's discussion will be that you get to hear from our client on how this next generation benefits model is transforming one of the largest parking management service providers in the country. But I'd love to introduce who will be speaking with you today. And we do have two members of the WellSpark Health leadership team, Bert Wachelhausen and Dr. Wayne Rollins, as well as one of our esteemed client partners from LAZ Parking, Andi Campbell. Bert is the president of WellSpark Health and brings over 30 years of experience holding leadership positions at national and regional health plans before embarking on this journey to really create the vision and the strategy behind WellSpark Health. Bert also serves community volunteering at several nonprofits and sits on the board of directors for the Connecticut Women's Hall of Fame. Dr. Rollins is WellSpark Health's Chief Medical Officer and is responsible for, of course, the clinical and the well-being strategy here at WellSpark. Dr. Rollins also has held various leadership positions at a large national carrier and currently serves on multiple committees, such as the National Vaccine Advisory Committee, and is a noted thought leader on health equity and social determinants. And we are also very lucky to have Andi Campbell join us today. Andi is the SVP of People and Culture at LAZ Parking and is responsible for over 13,000 employees across the United States. She has been recognized many times by the human resources industry and of course her peers as a workplace behavior expert and is known for her cutting edge approach to people and culture initiatives. Next slide. So I'll turn it over to Bert to please kick us off.
Thank you, Annie, and hello, everyone. I saw from the registration list that There were some old friends that were joining us today. Some of you have been with us for the past few years and have seen us on our journey. Some of you are just getting to know us today. So welcome, everyone. We look forward to getting through the program. We do have a lot to talk about. So just to level set, a reminder, some of this is old news for some of you, but again, just to tell you a little bit about who we are. WellSpark Health is part of the Emblem Health family of companies. We have about 600,000 members who have access to one or more of our programs. We're expanding rapidly. We are in several states now, and we continue to add customers that give us a broader geographic footprint, as evidenced by LAZ Parking today. You know, the past year has really, you know, we use the words extraordinary times, but I have to say it's been extraordinary for us at WellSpark. We had a vision a few years ago that it was time to bring together the mind, the body, and the orbit of someone's world as we're trying to help them on their health journey. And there's never been a more important time to do that. And the pandemic has certainly shined a light on the need for this. We're hearing a lot from employers, both current and prospective employers, that are saying that their current benefit suite isn't working for them, and they're really drawn to our model. So I'm excited to share that with all of you today. So this slide again is just intended to talk about our breadth and depth of experience. The fact that we're part of the Emblem Health family of companies, it informs who we are and what we do at WellSpark. You know, Emblem Health and Kinetic Care, I use the words sick care. They're insurance companies, so we know what to do, or they know what to do when people are sick, and it's about, you know, the right coverage in the right spot at the right time, and it is financial coverage for when you get sick. And Advantage Care physicians, these are actually doctors and nurses located throughout the 5 boroughs of New York that are doing hands-on care. So when we talk about WellSpark as part of the family, we understand what it is for someone to be in the sick care system. And our mission and our goal is to keep people out of that system, or to help them access care at the right time and for the right things. So you'll hear Dr. Rollins in particular today talking about prevention, talking about lifestyle, and really trying to keep people on a good path to health. So as we move to the next slide, I'll just leave you with a couple of things. It's important to know that, yes, we come from an insurance family, but you don't need to have Connecticut or Emblem to get our services. We are agnostic of an insurance company. We'll layer into to a self-insured plan or a fully insured plan. We have customers that have us for some of our programs, and they're fully insured. So again, agnostic to the carrier. We're also agnostic to some brokers and consultants use a data warehouse that they like. It could be MedAI, it could be Springbok. We're agnostic to those platforms as well. We have our own, but we'll use anyone if the program and it's the data that you want. So I just wanted to level set with that. And then if we could move to the next slide, please. So WellSpark was born several years ago. I think as I look back on where I was really observing that the current model is flawed, and there's just so many point solutions out there. And again, I talked about the sick care system, but even within that, if you're an employer, the whole landscape is fragmented, and we hear this a lot. You know, for disease prevention, we have Virgin Pulse, or we have Omada, or we have Livongo, and all of these pieces and parts need to fit together in a landscape. But what I observed several years ago is that people were falling through the cracks. And if you're using one service, then you had to actually conform to whatever it was with that particular point solution. If you were going to a vendor for diabetes monitoring, you had to use their glucose monitor. So everything was really contained in point solutions, and I felt that, you know, people were falling through the cracks, and it was always, well, that's not me, that's the other guy. And so I think what you'll see come through today is just the desire, yes, to take care of the whole person in our biopsychosocial model, but also to surround that person with an ecosystem of resources. So whether it is social resources or cognitive behavioral coaching to really help people with stress and anxiety, we're bringing all of that to bear because we really believe that one size doesn't fit all. Health isn't one-dimensional, and there are barriers to health that unless you really connect with someone as a human, you really can't unlock what those visible and invisible barriers might be. So next slide, please. Dr. Rollins, over to you.
Thanks, Bert. There are 4 clinical pillars at WellSpark Health: the biopsychosocial model, which we're going to spend some time talking about today, culturally competent healthcare, lifestyle, or using lifestyle as medicine, as well as promoting self-management skills. Now, over the series of webinars, we'll review each of these pillars and see how they contribute to improving an individual's overall health and well-being. Could I have the next slide, please? Thanks. Now, at WellSpark, we recognize that health and well-being are unique to each individual, and we focus on overlooked conditions and risks, as well as people who may be struggling with their health. Our goal is to build trust by understanding people's beliefs, values, and perceptions about health and disease. This way, we can best support them to a better health and their enduring well. Now, we understand that our programs must connect with people in their world to reach them in their life to be successful. Next slide, please. Now, Bert talked about the life dimensional approach, and we support people by using our life dimensional approach. And the power of the life dimensional approach is fueled by the biopsychosocial model of health. And let me spend some time describing this to you. The biopsychosocial model of health views health and illness as a product of the biological characteristics, behavioral factors, and social conditions. The biopsychosocial model of health simply states that the workings of the body, the mind, and the environment that we live all affect each other. It's like a 3-legged stool. You have to have each leg strong and each element strong to be able to fully support that stool, which is your health and well-being. For that reason, health and well-being activities must address the deep interrelations of all 3 components to fully engage individuals to improve their health and well-being. Now, most health plans and providers only focus on the biomedical model of health. A few plans do focus on your psychological and emotional health, typically by referring you to a behavioral health or an EAP vendor. And almost no plans or providers focus on what's called the social determinants of health. And why is this even important? Let's spend some time just touching on this. According to the Robert Wood Johnson Foundation, only 20% of an individual's health is tied to clinical care: doctors, nurses, hospitals, pharmacists, medications. 80% of an individual's health is tied to social determinants, where you live, learn, work, play, and pray. Behavioral factors such as exercise and smoking behaviors and your physical environment. And let me just stop, because I really want to emphasize this point. Health behaviors, socioeconomic circumstances, and your physical environment have a greater impact on you being able to live a long, healthy life than all the clinical care that you receive. That's the reason why we at WellSpark believe that using the biopsychosocial model, coupled with using lifestyle as medicine as a primary modality rather than medications, is the best way to prevent and treat chronic disease and improve health and well-being of individuals and populations. Now let me go to the next slide and turn it back to Bert.
Thanks, Doctor. So I talked a little bit about the human connection, but certainly we have to make all of our programs available in a digital format to meet people where they are and how they want to access services. So this is just to reinforce, we have an app, yes. We're doing one-on-one coaching telephonically, digitally, and on site when we can be. A lot of our programs, and diabetes prevention is one of them, where we've had great success being on site, but we've also had great success in bringing those programs to life in a digital format. Secure online chat, coach peer support. The punchline here, it's really, really about how does an individual want to connect with us? And so we have all of the modalities that an individual wants to in order to access our program. So it's about promoting healthy screen time for sure. But again, we say and we maintain. In fact, we've taken some clients recently from an all digital health provider where they say, you know what, all digital all the time just doesn't work for my workforce. So if we could go to the next slide, I want to talk a little bit about the human connection. We have nurses, we have health coaches, and both nurses and coaches aren't just, again, focused on the biological. It's not just about setting goals to lose weight. It is being trained in listening and cognitive behavioral coaching, and not just trying to fix if you're a nurse, and educate about the value of a good diet or the importance of taking insulin if you have a chronic disease or diabetes. It's what is standing in the way of you doing that? What is it that is in your world where you may be taking care of others instead of your health? So the human dimension of this is really, really important. And again, we're hearing that all digital all the time may have worked for a couple of years. It was new, people embraced it, but there is a movement back to a nice balance between digital if you want it, human when you need it, and it is the value of that human connection that we're finding is really unlocking these problem barriers for our participants. Next, please. So I want to take a minute and tell you we come from a health plan, and so where do we fit? And it's been interesting because as we try to disrupt the market, there are things that people are trying to put us in a box. Oh, you're a wellness plan. Nope, no, we're not. Oh, you're disease management. Nope, no, you're not. Or no, we're not. We're actually trying to be that Venn diagram between disease management and employee assistance and perhaps some tier 1 behavioral health. And so as we look at the healthcare continuum, which is classic, physical care, we filled the gaps in preventive care, certainly. We do have programs, yes, for flu shots and incentives and that kind of thing. Dr. Rollins and I often joke, we're trying to make prevention sexy again, if it ever was. Rather than sick care, we're focused on prevention. And we're also focused on, though, if you have been diagnosed with a chronic disease, how do you stay on a good path of self-management? So we fit in the spaces where a health plan, quite honestly, isn't focused. When you're a health plan, it's the right care in the right setting at the right time. And this is, we acknowledge that we're trying to keep people out of the system, as I said earlier, but there's going to be times when participants start to slide and get off track. And so we've developed a playbook for how to work with a health plan, how to pass a member back to a health plan when they need complex case management, perhaps, and then a playbook for bringing that member back into our lifestyle coaching and self-management program when they're ready for that. So again, we've developed the playbook. The fact that we come out of a health plan family gives us a lot of expertise. And quite honestly, our client base, again, we're agnostic. This playbook comes in handy when we're working with Anthem or United or Aetna, passing members back and forth. So again, don't want members falling through the cracks. That's really, really important to us. When we talk about the chronic disease, the people that we help with chronic disease, it's usually falling into what we're fondly call the 7 stealth diseases. And these are lifestyle related, as Dr. Rollins said. And as you see here, it is hyperlipidemia, hypertension, coronary artery disease, certainly diabetes. But non-alcoholic fatty liver has actually recently come on our radar in a big way. We recently wrote a new contract and are in a new relationship with the Healthy Trucking of America, with that association. And there's a lot of health issues associated with that population, and non-alcoholic fatty liver has a high prevalence in that population. So certainly that becomes part of the 7 Stealth, very much lifestyle related. And so we're helping folks and drivers in a way to help manage their diabetes, pre-diabetes, and then soon to be other chronic diseases. So just to pause and say, this is where we fit. And again, we're informed because of the fact that we come out of this health plan family of companies. Next slide. So this is all of our positioning, all of our programming. It really comes back to this is how our programs show up in the market. We have 4 product verticals, all with the biopsychosocial model. So Help 364 is our chronic disease self-management program. We call it Help 364 because we say, you go to your doctor, you've been diagnosed with a chronic disease, and then you're kind of on your own for the rest of the year. So it's the 364 days that you don't see your doctor. This is when our nurses are there to provide ongoing support and help with self-management skills and protocols. And this is, not everybody needs the same level of touch. So we're really trying to adapt our programming to what is someone with diabetes or hypertension, what do they need from us? And so this program is really focused on developing the self-management skills associated with a chronic disease. We're also, as I said, it's about prevention as well. So we have a diabetes prevention program that has been certified by the CDC. I mentioned it in my open. We have actually been beating the CDC statistics for and national averages for weight loss and attendance. So we're really proud of that program. That is our, I'll say, our hottest seller right now. And this is where the Healthy Trucking Association has started with us. But it's also focused on lifestyle as it relates to preventing hypertension, metabolic syndrome, and non-alcoholic fatty liver disease. Health Coaching for Life, this is a program that Andi Campbell is going to talk about. This is what the biopsychosocial of coaching that LAZ has chosen to work with us on, and she'll tell you more about that. But this is really where we're using coaching as the new front door, and then to programming where it is not just about the physical, it's about using the coach to work with a participant to unlock the barriers, again, that may be standing in the way of someone's health challenges. Last but not least, we do have worksite wellness programs. This is what I spoke about on the Where Does WellSpark Fit page. We do have programs for incentives, bringing in biometric screenings, incentive for flu shots, and so forth. All of these programs sit on the same digital platform. All of them are available on our app. So that's how it all ties together, and that's how our programming comes to life. But I'm going to ask Andi now. I think that's where we're going, Andi, right? Andi, to talk about what LAZ has done in their health coaching program. So Andi, I'm going to turn it over to you.
All right, thank you, Bert. Hopefully you guys can hear me soundly. I appreciate you having me, first of all, and I should say thank you very much for the opportunity to share a little bit about LAZ's story and why we believe that the work that we're doing in partnership with WellSpark is so important. So if you could go to the next slide, that would be great. I'm actually going to start with a little story, if you'll indulge me, to give you some context about why this work is has become so important for us at LAZ. If I take you back in time, back to 2015, I personally had taken a trip to Bali, a little bit of a last minute thing, and sounds very eat, pray, love. It wasn't turn out the same way, but while I was there, I had an experience where the Wi-Fi was spotty and I was in a totally different time zone, and people on my team weren't calling me and asking me for help. You know, they weren't hunting me down in my hotel or calling the airline because they had decisions they needed me for. And it was the first time in my personal life where I realized, wow, I'm really married to my job. And that began for me a journey personally toward understanding the relationship between an employee me and other employees and their career and their identity around that and how that impacts their health and their well-being. And so I share that story to say, through that process, what Dr. Rollins and Bert were talking about related to the idea of wellness not being one size fits all and health not being one-dimensional. I've personally found over the last few years so many stories where that has shown itself in a variety of ways. I have an employee I worked with through this journey and found out that he was struggling with a situation with his child who was showing signs of depression and threatening suicide. And I had an employee on my team who was dealing with a situation around finding care for his child who had just been diagnosed with a disease, or having to deal with a team who was a new parent and needed to figure out how to navigate not only the new parenting part of the process, but the stress that went with it. And then having somebody I work with who has diabetes and was struggling with getting into a routine for how to manage his medication. And it goes on from there. And obviously in my case, there's thousands and thousands of employees, all with a different set of circumstances, me personally included. So this was a personal journey that led me to an opportunity to say, wow, we could do this differently at LAZ and make a real difference. We're a people first company. And what better opportunity for us to demonstrate that people first than to build the types of programs that would really, over time, allow us not only to see impressive success with our cost of claims being self-funded, but also, of course, taking care of our people and being able to tell the story that that's really what it's all about. So what you're seeing on the screen are some of the things that we did and have been doing over the last few years, leading up to a year ago when we began engaging in some conversations with WellSpark. One of the first things that we began to do was create some value-based insurance design. And we knew we could hire WellSpark, or we could have our own coaches, which we had already actually. And regardless, we needed to take a multifaceted approach, knowing that we wanted a plan design that supported people making good decisions and, frankly, removing the financial barriers to getting care, which is what the value-based insurance design concept, at least from our lens, was all about. And so we began to come up with what we want, what kind of care do we want to make the most accessible, and how could we do that through the design of our plans. We began, obviously, some proactive outreach. We were already doing a little bit of this internally. We initially had 2 health coaches working for us full-time. Now, since have outsourced that to WellSpark, and one of our coaches went along over to WellSpark, actually, to work there full-time and support our employees. But through both the WellSpark model and our own ongoing education internally using the data that we get from WellSpark, we on a regular basis are doing a significant amount of outreach to get people engaged. Fixing co-pays for mental health visits was a big deal for us. Some of the examples I gave you, and like I said, the list can go on, made it really clear to me that people needed to know that not only can care be financially accessible, meaning mental health support therapy, be financially accessible, but also, it's not a shame. Don't be ashamed of it. In fact, we don't want you to be, we think it's so important that you get the care that you need that we're going to fix the copay across all of our plans to help you get there. And that's how we say mental health is so important that we are making it accessible too. We have a lot of focus on health literacy at LAZ, and we do that in combination of the MySpark Central platform through WellSpark and the videos there, which we require a certain number of those through our plan design, which I can talk about in just a moment, and then through LAZ University, which is our own internal platform for delivering learning to all of our employees on demand. And we also offer some non-on-demand, so some synchronous experiences just like this one. We have targeted weekly communication to get our folks engaged across all kinds of topics, everything from how to access care to how to get educated to what does this acronym mean in the healthcare piece to how do you manage your diabetes. And we do things across our entire population. We do things that are targeted, and we try very hard to use the data to make good decisions to drive engagement across our population through our communication. And then, of course, integrating this biopsychosocial concept into our own learning, our leadership curriculum, our own practices within LAZ, so that it becomes WellSpark really and LAZ are an extension of each other. We're talking the same language internally as our WellSpark coaches are speaking to our employees when they're engaging. And the result of that is then we end up with this holistic experience. So I'll pause there. Before I go to the next slide, I'll just give you a little bit more background in terms of some of the things that might be on your mind as you're speaking to potentially some of the people that you would be sharing the WellSpark with. First, talking about the cost and how to overcome that barrier as an employer, because obviously there's a cost to all of this. And of course, you know, I would love to tell you that every CEO is going to be able to say, oh yeah, no problem, HR, go ahead and get that. I can see how it can offset the, you know, be offset in the cost of claims. It wasn't easy for us up front. It wasn't nearly that easy. So, you know, first we funded the cost of these programs by offsetting it with wellness credits through our health carrier at the time. We had an amount of money that we were getting for our wellness programs, and we offset it there. And then we began to quickly see results. And so put our business brain and HR around it and said, okay, well, if we're seeing results, how can we attribute that to claims? We are self-funded. We were able to come up with a formula that said if we save on these types of claims, if we increase the number of people getting preventative care, if we do these numbers of things, we can assume a certain amount of claim savings, and that's how we were able to demonstrate and offset the cost. And so we obviously have continued to use that same, we'll call it pricing model, to show why the cost of this is really negligible, because ultimately when we see, you know, we have one employee not hit stop loss, for example, as a result of them getting coaching, then I know for certain we're nearly paying for itself. And we have countless examples over the years of how through coaching we've done that, and now over the last year, I'm already seeing many results through WellSpark so far. And in fact, as it relates to results, I'll just share that, you know, preventative tracking is already, preventative care is already tracking above average for us year to date in 2021. We're already seeing our claims tracking at least neutral to 2020, if not below, in terms of a cost per employee per month, and certainly below what we budgeted for 2021, which is obviously exceptional. We're seeing less hits to our stop loss year to date already, which is big news for us. And of course, engagement in coaching at an all-time high. So far this year alone have been pretty exceptional. And so, you know, it's not just about saving money. It's a multifaceted approach that goes beyond just the idea of, you know, saving money on claims, but, you know, what are we doing right for our people? Are we giving our people what they need to be as successful as they possibly can be and live in a more holistic way? If we go to the next slide, I can give you a preview of what it really looks like in concept with the health coach at the center. So, you know, when an employee either through volunteering or having an interest by responding to one of the emails that we send or some of the outreach we do or the outreach from the WellSpark team. So, you know, they either through us reaching out or by them volunteering to engage, then it immediately goes to our coach, who from there would be able to, well, loosely use the word diagnose, right? But be able to identify what it is that this employee is looking to change, what kind of behavior can we influence, what are we trying to solve for with this person, and then drop them into the system in the most appropriate way to help them to get to the right result. We're doing this obviously through lifestyle factors, you know, the stuff you're seeing on the left-hand side of the screen, of course, and but also there's a significant amount of this that's chronic disease management through a cohort that's been identified by WellSpark, who they're actively outreaching to. We were able to have them look through our claims and say, well, where are you seeing historically the largest volume of claims as it relates to chronic disease? Let's see if we can tackle that group of people. And that's where we've been able to marry the difference between, or marry up the outreach as well as the outreach from LAZ. So I'm going to pause there, Andi. I'm not sure if I'm answering some of the questions I think you guys had on your mind for me to share, but I'll pause and see if there's any questions I can answer about what I've covered so far from folks who are attending.
We did actually have a question come in. I know you had mentioned data, and obviously you work with the health plan now. How did you negotiate with the health plan to, you know, get that starting data to really help you figure out what type of cohort, if you will, you would want to pursue using the WellSpark program?
Yeah, it's a great question, and something I think my peers in HR sometimes, more than sometimes, struggle with in working with carriers. And the reality is that data is our data. That is the data. We own the data. We own that claims data. That's our employees' information. As an employer, we own that. And I share that because what I implore my peers to do, and I know that I happen to be partnered with a broker who believes the same. We're just relentless. Like, we will get this data. However, if we have to build it into when we build it into our renewal, if we're building it into the pricing structure, we're doing whatever we have to do to enforce the accountability that the carrier provides the data to LAZ in whatever way we describe. So initially, before we met WellSpark, that was through a data file feed that was going to a different system for us to take a peek at our claims more holistically. And that was when we had our health coaches working internally. We then translated that and said, okay, now we'd like you to point that data toward WellSpark instead, into WellSpark's system. But we just wouldn't take no for an answer. And it can be done. And I think what happens as HR folks, and particularly, we get caught in the system, and we have to speak our minds and remind and hold our partners, our carriers, accountable for the fact that that data is ours and not theirs. And as our broker, as I mentioned, we've been very aligned to our broker on that methodology, and they've been bullish in helping us make that happen. And so I think it is the responsibility of the employer and the broker to hold the carriers accountable for who owns that data, because it can get confusing sometimes, and that doesn't always serve the employer. So being laser focused on accountability. No, this is ours. How can we make it happen? Even if we have to pay for it, it would be worth it. Although I would argue that I would argue that paying for it sucks. But if you got to do what you got to do in terms of paying for reporting, if that's what it takes. So
that's very helpful, Andi. Thank you. I know you've kind of outlined this model that you and WellSpark both really believe in, and can you tell us what's next on the horizon for you? When you started this process, you probably thought, okay, we're going to really revamp our health coaching model. We already believe in it. We know it works. Is there something else that you're planning to do?
Yeah, good question. So there's a few things. I think just as it relates in general to the health coaching model, and specifically around around medical claims and improving those, or our health costs in general. It does go beyond the cost of claims, and I think it's important to recognize that there are other things that we could be looking at that would help us to know whether or not that this type of program is successful. Are people feeling more engaged in their work? Are people feeling, if we see an increase in the number of visits to therapists, I would call that a win. It might be more in claims, but I would call that a win, because I would say that people are getting better care and they're taking their care more seriously. We're certainly tracking the compliance of our new plans. By the way, I didn't mention this. We had 93% of our total employees enroll in one of our, we call them the plus plans. I called them the value-based insurance design plans. We gave people an option, and we said, you do this. If you do this, you'll spend a little less. Your cost of care, meaning your cost of care will be less, and your biweekly premiums will be less. You don't have to. And so 93% of our population opted in, which we're very proud of. And I think that's important data. But from there, we're also tracking compliance to what we set out to do. We're giving you lesser cost of care, and as a result of that, we're asking you to do your preventative exams. We're asking that you do what you need to do if you have a chronic disease and manage that successfully. We're asking that you take videos through the MySpark Central platform. So there's other tracking beyond just the cost of claims that we're really looking at on a regular basis. And so those things are really important. And then beyond that, and if you go to the next slide, I can share a little bit more about some of the other places where I do think employers have an opportunity. Self-funded, not only on healthcare, but we're also self-funded on our workers' compensation programs. And if you've done any research on workers' comp, you know, similar to health, when people are healthier, they come back to work faster after having an injury. So we started to brainstorm, Bert and I, and we were like, well, wait a minute, why not apply this same coaching model to our folks who are out as a result of an injury and see if they need some support, either getting back to work, health, literally physical health wise, or is there something that we can do to support them? Are they afraid of coming back to work because they don't think they'll get the support they need from their manager? Or are they potentially struggling coming back to work because they have somebody at home who wants them to stay home? I mean, who knows? There's so many different factors. But as a self-funded employer for workers' compensation, it behooves us. We pay the first $250,000 of every claim, and our average claim is $34,000. So for us to be able to move that needle, we know that when people go back to work more swiftly, then we're obviously going to pay less money on those claims as well. So we've just started some good dialogue on how we will be launching this impact study on workers' compensation, and hopefully we'll be launching that May 1st with the help of a claim, engaged in health coaching if they want to, voluntarily, of course, but we'll be doing some good warm handoffs. So we hope to see those numbers at least be significant enough for us to study, and the result of that hopefully will be not only cost of claims saved on the medical side, but also on our workers' comp side as well. And frankly, the model applies. You know, if people are out on injury, or they still have lifestyle factors that potentially could be barriers for them to either come back to work or work as well as they possibly can. So those are some of the things that we have on our mind. And of course, you know, there's lots of ways that we can measure our success through this and our healthcare model. As I mentioned, some of the ways on the healthcare, beyond just saving money on claims or getting people back to work more quickly, you know, are people feeling more loyal to LAZ Parking as a result of them having had an active outreach from someone while they were out on a claim? I mean, Bert and Dr. Rollins talked earlier about human connection. Talk about a human connection. They're not only getting a call from their HR business partner when they're out on a claim, or maybe their manager, but also they're going to get a call from a coach and be offered free support. That's amazing. And I would hope that that ends up showing that we, you know, potentially keep our employees longer. We may see some improvement on retention. So I should also caveat to say, like, obviously LAZ Parking as an employer, we have people running cars, so our workers' compensation, we're getting people hurt all the time at work, but you know, the type of business or the nature of the business that we're in, this is a place where we do see a high volume of claims for a large variety of reasons across locations around the country. So these are some of the things that we're working on in partnership with WellSpark. You know, so far our results are really fantastic, and we look forward to continuing the process of figuring out new ways that we can support our employees through their this whole biopsychosocial model.
And I think it's really interesting too, Andi, that your company is willing to support not just your full-time benefit eligible employees, right? So this is an opportunity for you to touch even more of your workforce that may not even have access to some certain benefits at times. So it's really a great opportunity.
Yeah, that's right. So yeah, and as Annie just mentioned, we quite a big volume of our workers' comp claims come from people who are not enrolled in healthcare because they are maybe part-time, not benefits eligible. So yeah, this will extend the WellSpark reach even beyond our employees who are eligible for benefits.
That's great. We actually got a question about, I know you mentioned some metrics early already, your early outcomes, which is, thank you for sharing that. We also had a question about just any like member successes, any success so far in your early program. And we happen to have a slide on that. So that was a great question, whoever asked it. If we flip forward, maybe Andi, you can just talk about one of the members that you know, we've already seen some success with.
Yeah, I think Bert was going to talk about this one, but before we even go to this one, I can give you guys a couple of anecdotes, and then you can a slide. That's fine, and we can talk a little bit about this one. But you know, a couple of just success stories that have come in, at least my way, anecdotally, beyond just the one that you're seeing on the screen. Before we go here, you know, I just personally did a an interview, I'll call it, with an employee who was so moved by his work with the health coach that he wanted to tell his story to LAZ to see if there's anybody else out there that might be inspired to get help as a result of seeing his story. He's a higher level director of operations, the national director of operations with our hospitality team, and highly visible within the organization. And he started working with a health coach a year ago, and his results, he told me he signed up to work with her and expected something entirely different than what he got, and he couldn't be more pleased with the results that he's had. He's learned to really navigate his work life more effectively, manage his stress, help his wife through a variety of different circumstances, show up in a more present way. I mean, there's different things he shared with me that span so much further beyond, his diet and his exercise. And he literally said to me, I will think twice before ever leaving LAZ, because this type of experience and the fact that I'm being offered this for free just by being an employee is significant. And to me, that's a win. That's a huge win. As the head of HR, to be able to look at an employee in the eye who's sitting here saying to me, as a result of this, I won't leave LAZ because no other company has this. And I think that's really powerful. I think Bert was going to share this story, or am I doing this, Bert? Sorry.
Yeah, Andi, we can certainly tag team, but this was a story that came through one of our health coaches, and the stories come through on a daily basis, and it's just it just really fills the hearts of the coaches and nurses who are really doing great work on the front lines. It just fulfilling our mission. And so this was an individual from your company that worked with a coach, and as you can read, she actually went into the hospital with a blood pressure of 235 over 119, struggling with her hypertension medication adherence, and she had a goal of losing weight, but had not put herself on a path to do that. And so in working with the coach, we unlocked some barriers to care and got her all squared away. We don't give medication advice. It's really important for us to let everybody know we are not doing hands-on care. It's all about make sure you ask your doctor about these things. But our nurses can answer some basic questions about medication. But then it was really putting Diane on a good path to health. She needed to at least stay engaged with a coach, a nurse in this case, but then started to walk with a virtual partner and got engaged and started walking, and 3 pounds in 1 month and lowered her blood pressure to 137 over 84. So feeling amazing is great. If only we had gotten to her before she went in the hospital, that would have been an even better success story. But the fact that we have engaged with her, put her on a good path, given her some skills, answered a lot of questions about her medication. This is one of many, many success stories that happens every day at WellSpark. So again, it's about identifying who the folks are, stratifying them to make sure we're getting the emerging risk, as I talked about way up front, engaging that participant in one of the many ways that we talked about, and then measuring our success, the success of the intervention, both on an individual basis, which is what we've done here with Diane, but as Andi said, on a macro basis, are we really helping that business solve for the business issues associated with an unhealthy workforce? Are we helping them save money? Are we helping them with absenteeism? And are we helping them with retention? So again, I come back to, it's the whole person, but it's also the whole ecosystem and how we're trying to work with companies to improve the health of their workforce so that they get better results all around.
And Andi, I can give you one more quick one that isn't on the screen, in addition to the two stories we've shared so far. This one, probably important for folks to know, our population, a lot English second language, many of them first generation American, and so didn't grow up with preventative care being comfortable. So we had a situation with an employee who had been found by his brother having in a diabetic coma in his apartment. His brother just randomly happened to stop by and found him in a diabetic coma. Ends up going, didn't know, obviously it was a diabetic coma because he didn't know he had diabetes, ends up going to the hospital, blah, blah, blah. Anyway, diagnosed with diabetes, comes home with all this medication, not sure what to do with himself, sugar like, you know, through the roof. And our health coach reached out to him because he showed up on the list of folks with chronic disease. And she told me the story and said that when she called him, he said he had been praying for a miracle because he didn't know, and he had no idea. He was even diabetic. He didn't know how to navigate the system. He didn't speak English well. And here she called, and she was his miracle. And to me, I mean, I get chills. Maybe it's because I'm attached to these employees at LAZ, but I think it's just such a beautiful story that demonstrates the power of how important, you know, how powerful and important it is that we remember that at the end of the day, what we're doing with WellSpark is about helping people. And this person now on a good track for his own health and well-being, which obviously we're thrilled about. But I'm just I'm moved by that story, and as Bert said, they come in every day and they're countless. So
that is truly an amazing story, and appreciate you sharing that. It's actually a really good segue to our second webinar, and so I'll call upon you for that maybe later on here. I'm going to give a little preview, but we have a few minutes. I think we had one more question in the chat, but feel free if there's any other questions to put that into the chat box, or excuse me, into the Q&A box really quickly. But I think we did have one, and it is for you, Andi. I think that 93% must have just stood out to everyone because it's an amazing number. But it's how did you sell this VBID program? Obviously, you got great results and people opted into that plan. But how did you sell this VBID program, spotlighting health coaching to your employees?
Yeah, it's a good question. I think sometimes as employers and in HR, we get a little stuck in kind of being fuddy-duddy, honestly, about open enrollment. I don't know if that's the best word to describe it, but you know, last year we said we've got to do something different to get, you know, it's 2020, people are stuck in their houses, we don't have the in-person engagement we've always had. How are we going to reach our people and really educate them that there's all these new plans available? And so what we did is a program called Rock and Roll 2021. And so we basically kind of had a lot of fun with our whole open enrollment process and education, and we turned it into a concert theme. And we said rock and roll powered by WellSpark. And that's how we introduced WellSpark. It's how we introduced our plans. We did videos, we had dancing, we had stage interviews, and all kinds of interesting things. And that's how we began the conversation. We started the conversations well before open enrollment through a variety of different email campaigns. We did text campaigns, and then through the open enrollment process, a lot of different medium, all focused around this concept of rock and roll. So instead of come to open enrollment, we said, you know, we had countdowns to rock and roll 2021 and did the best we could to make it fun. And I think it worked, obviously, from the results. And so, you know, obviously, you know, the cost of the plans being a little less drives people to the less expensive plans. That's also by design. So hopefully we'll see what happens as we go toward the end of 2021 in terms of the compliance with the plans and whether or not we see the same level of enrollment in these plus plans for 2022, but I would be surprised if we don't.
Well, that's definitely the most fun open enrollment campaign I've ever heard of. So I appreciate that. We look forward to seeing how you're going to top that for 2022. Well, if we did not get to your question, we'll absolutely follow up with you. And if you don't mind, well, first and foremost, thank you, Andi, for being here and presenting your stories and all the different successes.